Hello everyone. Today I am going to talk on a short but very important topic which we come across in our practices from time to time but not taught in our colleges. The topic is dentist consent for surgical treatment. That is, we are supposed to give consent to the surgeon that patient is dentally fit for the necessary surgical procedure. In this topic, I am going to elaborate why dental fitness is important for some surgical procedures and how, as a dentist, you should determine whether the patient is dentally fit. Now, in cardiac surgeries, it is recommended that patient undergoing cardiac surgeries should be referred to a dentist for complete oral and dental examination with proper radiographic examination. This is to identify septic foci such as lesions associated with caries, periodontal diseases, and mucosal and intraosseous lesions. Chronic non-infectious diseases and aesthetic treatments can be postponed. Normally, bacteremia lasts 24 hours after dental procedure. So, the cardiac surgery should be planned after that period. It is also important to do all dental procedures leading to bleeding before cardiac surgeries, as patients are invariably on anticoagulants for longer duration. Now, as far as ophthalmic surgery is concerned, again here dentist consent is very important, and usually an ophthalmic surgeon sends patients for dental clearance. Dental infections of any sort may lead to problems with cataract surgeries or corneal implants. Eyes are prone to becoming seeded with infections from other parts of the body, and endophthalmitis is a devastating complication. So all dental infections should be eliminated for at least 2 weeks before eye surgery. If it is not possible, some doctors suggest antibiotic cover for 1 to 2 weeks prior to surgery to reduce bacterial load. After surgery, a gap of a week or two should be kept before starting dental treatment, which is to avoid bacteremia and physical pressure on operated eye by dentist's hand holding mouth mirrors. Best is to ask the patient to wear spectacles or goggles to avoid pressure and light of our lamp. Now, as far as orthopedic surgeries are concerned, it is very important to keep good oral hygiene before knee replacement surgeries or orthopedic surgeries, where orthopedic surgeon advise to avoid any invasive dental procedure 6 to 8 weeks prior to knee replacement, as bacteremia spreads through bloodstream and settle in joints. In 2003, American Dental Association and American Academy of Orthopedic Surgeons issued a joint statement that patient should take antibiotics an hour before dental procedure for the first 2 years after knee replacement surgeries. Nowadays, this theory is not universally accepted, and they claim that this overuse of antibiotic is unnecessary. I personally feel you should take advice and consent of operating surgeon before any invasive dental procedure to be on the safer side. Now we will consider our role as a dentist in all this scenario. First and most important, never give a consent before examining the patient thoroughly. Check the entire oral cavity, see for any carious teeth, root pieces or periodontal diseases. Don't succumb to patient's demand, as he usually comes to you after his operation is scheduled and you are pressurized to give a consent. Consider previous points I have mentioned. It is also beneficial to us if you carry the entire treatment to eliminate septic focus. Non-septic focus producing cosmetic treatments can be postponed. Now are now radiographs are very important to diagnose periapical pathologies which are clinically invisible. OPGs should be advised for overall survey followed up by intraoral periapical radiographs wherever necessary. Wherever necessary. In the radiographs, check for 1. Proximal caries, 2. Periapical pathologies, 3. Root pieces, and 4. Bone defects due to periodontal conditions. According to the radiographs, appropriate actions are taken to eliminate and treat these septic foci. Normally, dental treatment should be carried out as follows before giving a consent. Removal of residual root fragments. 2. removal or root canal treatment of teeth with periapical pathologies. 3. Periodontal treatment with pockets depth more than 6 millimeter or loss of epithelial attachment less than half tooth length, or that means grade 3 or grade 4 mobility. If time is insufficient for root canal procedure of salvageable teeth, temporary root canal fillings with calcium hydroxide is preferable. Infectious or inflammatory mucosal lesions are treated. In case of suspicion, hematological examination is advised to check for leukocytosis suggesting infection and should be further investigated. To conclude today's topic, I strongly recommend to have a personal talk with operating surgeon. Never compromise and never give false certificates. You can't afford to be casual as if anything goes wrong post-operatively. The operating surgeon squarely put the blame on your shoulders. Keep nice documentation and records along with radiographs, photographs, and keep a copy of your consent letter to the physician. I am sure today's topic will help you giving a proper consent to surgeons. Please subscribe my channel, which is free, by pressing the bell icon. For previous videos, you can go to my website www.drrajevgadgil.com. Thanks once.